In this video, we'll be talking about artificial fertilization treatments at Rajni IVF. More couples than ever are struggling with infertility, and if you and your partner trying to conceive and unable to get pregnant, it's time for you to get help. Rajni Fertility Center offers a range of fertility treatments to give you the best possible chance of having a baby. There are more number of things we'd recommend you explore, right from diet changes to yoga and medication before arriving at artificial fertilization. Rajni Fertility Center has helped many couples to have healthy and successful pregnancies. Some of the most effective and well-known artificial fertility treatments available at Rajni Fertility Center are 1. IUI, artificial insemination. 2. IVF, in vitro fertilization. 3. ICSI, intracytoplasmic sperm injection, also called as ICSI. Artificial insemination, the most common type of artificial fertilization. During the procedure, the semen is collected from a partner or donor. The technician will aspirate a small amount of semen on a glass slide for analysis under the microscope. The quality of the semen is assessed. After the analysis, the rest of the semen is transferred to a density gradient centrifugation procedure to extract the motile sperms. The procedure involves a high-speed centrifugation. The sperms with high motility will settle at the bottom of the tube. The motile sperm will now be collected from the bottom of the tube. Under the microscope, the small amount of motile sperm preparation is observed. The prepared sperms show a much higher motility with forward progressive movement. These actively motile sperms will be loaded into a catheter, and the doctor will insert the catheter through the cervix and into the uterus. The actively motile sperms will quickly swim into the fallopian tubes, and the egg will be surrounded by the actively swimming sperms. These sperms will swim towards the egg, and only one of them will be able to get inside the egg. After 2 weeks, the pregnancy test is performed, and also the fertility medicines may be used alongside this treatment to stimulate the ovulation. IVF, in vitro fertilization treatment. IVF involves a woman's egg being removed from her ovaries, and the eggs are fertilized naturally by sperm cells, but in vitro, meaning outside the body in a lab, which usually results in the formation of embryos, and few of the embryos may be frozen for later use. Before this procedure, the woman may need fertility medicine to encourage egg cells to be released. When they are matured enough, eggs will be removed from the follicles with a special egg retrieval needle. The retrieved eggs are identified under microscope. The eggs will be placed in suitable culture medium immediately. Sperms would be added into the drops culture medium containing eggs. The egg is surrounded by the bunch of actively swimming sperms. The sperms will swim towards the egg, and only one of them would able to get inside the egg. After 24 hours, the zygote will divide into a 4-cell. The embryo will be carefully deposited onto the appropriate side of the uterus. After 2 weeks, the patient will have a pregnancy test to confirm the successful implantation of the embryos has taken place. ICSI, intracytoplasmic sperm injection, also known as ICSI. ICSI is a form of vitro fertilization in which fertilization occurs outside the body. The egg is fertilized outside the body. First, the egg cells are harvested, then they are placed in a special media in a laboratory dish. Within few hours, a sperm is carefully injected directly into the center of an egg cell. When successful, the cell will divide and form the first stages of an embryo. Several eggs are harvested and fertilized at the same time. Then they are placed back into the woman's uterus. Visit Rajni Fertility Center for initial diagnosis before you embark for any artificial fertilization treatments. Thank you.